Hey, thanks for tuning in. Today we're going to go over the differences between Medigap policies and Medicare Advantage. As you're realizing, the Medicare coverage options are a little confusing. You're not really sure which one's going to work better for you.
But don't get aggravated like this guy.
And when you understand how each one works, you're going to understand which type of program is going to work better for you in managing your own health care. So let's get going. Come on.
If you have not downloaded and or filled in the checklist in the prior two videos, I would highly recommend watching those first and having the checklist in front of you so that you can understand how these two different programs work and which coverage option is going to be best for you when you decide to enroll. So understanding your Medicare coverage options, I'm going to explain today how the Medicare Supplement or Medigap policy differs in coverage from the Medicare Advantage MAPD plans that are available in the area. When you have a Medigap policy or a Medicare Advantage option, you cannot have both at the same time. You can only choose one or the other. Let's say you go to the hospital, get lab work done, or go see the doctor. If you have a Medigap policy, what the doctor, lab, or hospital is going to do is going to send the bill to Original Medicare, which are parts A and B. They're going to process the claim, and then they in turn are going to send their reimbursement back to those providers. With Original Medicare, you must have a separate Part D program, which if you take medications, you will pay co-pays to the medications plus a premium for this standalone drug program. After your bill has been processed by Medicare Part A and Part B, then Medicare is going to send the remaining bills to the insurance plan to pay the balance to the lab, doctor, or hospital that performed the service for you. Now, on the other hand, if you have a Medicare Advantage plan, which is A, B, and D combined into one plan, typically identified by an HMO, PPO, POS, or PFFS, and what these are just basic structures. If you go see a hospital, get lab work done, or a doctor, what they do is bill the insurance company that you have. They will send their copay to either the doctor, lab work, or hospitals, and you as well will make up the difference of what the doctor or the lab work or the hospital charges. Now, your copayment amount could reach upwards of $6,700 depending on the area in which you live for in-network services. You could also be responsible for upwards of $10,000 of out-of-network care if the doctor accepts the plan. Plus, you're responsible for any co-pays for any of the medications that you take. Now, the differences between the two, on the Medicare Supplement side, you pay a monthly premium to the insurance company to cover the out-of-pocket expenses on the plan that you are enrolled in. The Medicare Advantage side, you pay a zero or a very low monthly premium for that plan. On a Medigap policy, you have 100% freedom to see any doctor that accepts Medicare. On the Medicare Advantage side, you have access to Doctor Network, and there's rules and guidelines on being able to access them. On the Medicare Supplement side, it's guaranteed renewable for life as long as you make the monthly premium. On the Medicare Advantage plan, it's a one-year contract from January to December, and it is advisable to have your plan reviewed every year. So when you are on Medicare, you have to decide which side of Medicare would you rather be on.
So there you have it. You now have an understanding of how Medicare Advantage plans work, and you also have an understanding how Medigap policies work.
I knew you'd understand.
Now, if you are a do-it-yourselfer, click on the link below to shop, compare, and even enroll into Medicare Advantage plans or prescription drug programs all by yourself. Now, if you want assistance, you need guidance, and you want to work with me to help you through this process, click on the other link that will take you to the appointment scheduler to allow us to set a time to talk. There you have it. You have everything in front of you. Thank you for listening, and I look forward to seeing you on the next one.